So my name is Alexis Whittam. I'm the Director of Communications for the Colorado Coalition for the Homeless. Thank you so much for joining us tonight for our education series for the month of September. Next slide, please. So today's session is on unique considerations for homelessness within the Latino community, and that's what we'll be covering today with a few local experts. Sorry, if you could go back, Gabriella. Great. So we'll start with a little housekeeping. We do have live interpretation on. If you've never used it before and you missed the introduction by Estefania, you use the little globe at the bottom of your screen and just be sure to click whatever language you prefer, and then you will hear everyone speaking in the language that you prefer. We also have live captioning available, so you can hit the CC button to show captions at the bottom. I do believe this only works for English. I'm not sure, but I think it only does, so I apologize. That will only be useful to those who are using the English language. The agenda and format. So we do these almost every month on the third Thursday of the month, and essentially the idea is for it to be educational to the community at large. We often get people who ask us for more specific information about how to get services or what to do in their case. This isn't necessarily the best place for that in terms of services. The idea is to be broad and educational. So if you know a lot about the sector and you're a partner organization, hopefully this is useful. And also if you're just someone who wants to learn a little bit more about homelessness, the session is also useful to you. So that's the idea. It's really a community event, and we appreciate all of our community members who join. If you're attending, your camera and your microphone is off. So if it's late in the day, if you're doing dishes, if you're driving home, don't worry, we can't see you, we can't hear you. The only people who are seen and heard on this are our panelists. So everyone else is in webinar mode. And that means that you can use the chat to introduce yourself and talk to each other. You can use the Q&A to leave questions that we'll answer in the last 15 minutes. But generally, your cameras will be off and your microphones will be off. This session is being recorded. We record all of our sessions and we put them on YouTube within about a week, usually the next day, but sometimes takes a bit longer. So if you like this session, or if you have to leave early and you want to see the second half of it later, don't worry, it'll be on YouTube and you can find it on our YouTube page in the future, which if you just type in Colorado Coalition for the Homeless, you can find it. If you're someone who likes to share on social media during, after, we always use the hashtag CCH Ed Series for all of our Ed Series. And you can always shout out the folks who are in this, the organizations who are in this, if you want to hit them up at their handles. We are at CO Coalition, and then we also have at 9 to 5 Colorado, and then at Servicios de la Raza. So before we get started, I know that it is Hispanic and Latino Heritage Month, and that many people who are on this already know these terms, but it's always helpful to cover this information to start with, just so folks understand why we might be switching language back and forth. So Latino is going to refer to a person with origins from anywhere in Latin America, including Mexico, South and Central America, and the Caribbean. Hispanic refers to a person with ancestry from a country whose primary language is Spanish. So there's a lot of crossover, but it's not exact. But what you'll find as we jump into our data presentation, which is going to be the first 15 minutes or so, is that we'll probably be saying, sometimes we'll say Latino, sometimes we'll say Hispanic. What we're doing is we're trying to reference what whoever gathered the data used. And so we want to be exact in referencing the data and their accuracy. And so that's what we'll be doing. And that's why you'll hear us jump back and forth. And some of our panelists may use one term more than another. So just so everyone knows where we're starting from. And then Latinx or Latina sometimes gets used just because it is a way to just not have gender in the words. And so it's a way to opt out of the gender binary. That's also very common terminology used, and some people will use that as well. Great. So as we jump into our data, we just like to always set the stage in these sessions so that everyone kind of understands a little bit about the topic. Don't worry, there's no quizzes. And don't worry, you don't have to take notes. We do send this out afterwards. So you will get a copy of this presentation if you registered for this event. So, just wanted to give you an overview of what we're going to talk about, but don't be worried. Don't need to take notes on this. So we're going to cover in our brief slides coming up, about 10 slides, homelessness nationally. for the Latino population, homelessness in Colorado, housing in Colorado, healthcare in Colorado, unique considerations regarding poverty, language, service access, some newly released polling, and some solutions that work. So first we have national statistics. According to the 2022 point in time count, which is sort of the national count of people experiencing homelessness that's used on a national level and generally recognized as the standard that is referenced. Hispanic or Latino people make up 24.1% of people experiencing homeless nationally, including 22.6% of sheltered and 26.5% of unsheltered. So generally sheltered is going to mean people who are going to a shelter to sleep at night, and unsheltered are people who maybe are camping out of doors, more that way. The number of Hispanic or Latino people experiencing homelessness has increased recently. It's increased by 8% between 2020 and 2022, and this was 16% for unsheltered homelessness. And then when we dig into the data a little bit more, the percentage of individuals who are experiencing homelessness who are Latino, Hispanic, it's highest in major cities compared to other areas. So it's just disproportionately, if you are a Latino person and you are in a city, you're more likely to experience homelessness than suburban or rural. And then there's more, once again, we're getting into that data and we're looking at more details. So there's differences between just a general, those first numbers we gave were kind of general. And then if we look at families versus individuals, there's differences. So nearly 3 in 10 people in families with children experiencing homelessness were Hispanic or Latino. And then this is higher than the percentage of individuals. So when we look at who's experiencing homelessness, it's more likely to be families than individuals when we look at the percentages. And for families, the percentage also is higher in urban areas than others. So 38% of urban families experiencing homelessness are Latino, but it is lower in other areas. We also see a difference in youth. So just over a quarter of unaccompanied youth identified as Hispanic or Latino, compared with 22% of all individuals experiencing homelessness. Hispanic unaccompanied youth made up a larger percentage of the unsheltered population as well. So we have more of an issue with youth. So in Colorado, so those were all national statistics. In Colorado, the total population of Hispanic Latino individuals is about 22% of our state. And the people experiencing homelessness, it's about 24%. So not a huge difference, but there is a difference in this case. Next slide. So we have some great data recently that we can look at in terms of how people feel. So now what we're talking about is not necessarily the number of people experiencing homelessness. What we're talking about is how the average Hispanic Latino person who was referenced in the Colorado Health Foundation Pulse poll, which has been coming out the last month or so, what their concerns are. So 82% of Hispanic or Latino respondents in Colorado believe that the cost of housing is a serious problem. Thanks, Gabriella. Killing it on the slides. Also, those same respondents are 28% are worried that they may lose their home because they can't afford it. And 57% of Colorado's Latinos had $1,000 or less in savings for financial emergencies, and more than a quarter had $100 or less. So we know, when we have these sessions and we talk generally about homelessness, that not having emergency money, being in a level of poverty makes you susceptible to homelessness. And we're really seeing that is probably why people are feeling that they're at risk of homelessness, and that people are reporting on this. 35% of people also report that they or someone they know has been treated unfairly when trying to rent or purchase because of race or ethnicity. So here we're not even talking about immigration status. We're not even talking about language. We're just talking about race or ethnicity. And we're already at 35% who may be, in addition to any sort of financial barrier, experiencing just a barrier as well, in terms of someone not, discrimination. And then in order to pay rent or mortgage last year, 38% of respondents had to work multiple jobs or more than they wanted at the one job. 18% had to move because they couldn't afford their rent or their mortgage. And 23% had to live with a roommate or in a friend family home because of financial reasons. And then, housing and health are correlated. We know that that's the core of our work here at the coalition. So when you look at also the health results from the Colorado Health Foundation Pulse report, you're going to see other results that concern us. 69% of folks say that mental health is a serious problem. And in the last 12 months, 14% had to skip meals because they couldn't afford food. 38% of Hispanic Latino respondents postponed medical or dental care, and 25% postponed mental health care. We also have Colorado Latino policy priorities according to the 2023 Colorado Latino Policy Agenda Survey. So policy priorities, according to those who were surveyed, include addressing inflation, improving income equality, solving homelessness, and lowering healthcare costs. So once again, what we're seeing are the primary concerns of Latinos in the state are about money, about homelessness, and about healthcare. And those things are all intertwined, as we know. And then 1/4 of people reported that they can actually afford where they live. So less than a quarter can afford where they live. And this information moves us into the foundation for a renter's bill of rights and protections. So when we're talking about solutions, we'll have a few solutions on our slides, and then of course that'll come up in our conversation. Protections for renters are really one of the main ways that we can prevent homelessness, is keeping people housed to begin with and not experiencing homelessness. So some of the barriers that we talk about that are going to impact Latino and Hispanic Coloradans more than non-Latino and Hispanic Coloradans who are perhaps on the precipice of homelessness or worried about homelessness. 20% of Latinos are immigrants. So we know that folks who have immigrated often do not have the same access to services as others. 38% of folks speak mostly Spanish. So a lot of services, a lot of forms, a lot of people who are there to help you get services are not able to speak Spanish when we talk about a lot of mainstream or governmental agencies, right? And then studies find that there's a shortage of Spanish translators in homelessness services, which prevents monolingual Spanish speakers from understanding the terms of rental contracts and homelessness services. So people might get into a worse contract for housing where the rent's going to go up an exorbitant amount just because of not having access to a language that they can understand even at the beginning. We also, of course, have to think about undocumented individuals who are often unaware of their rights as tenants or afraid to speak out if there are violations being committed. So a lot of landlords will really take advantage of undocumented individuals, thinking that they don't have a recourse if the landlord is doing something illegal. I know a lot of this is common sense to lots of folks on here, but it's important to put it out. And this all comes from data. This all comes from reports. So this isn't just anecdotal evidence. This is what it is found when we look at nationally the struggles that Latino and Hispanic folks face with housing. So once again, poverty is a big issue. Latinos make up about 18% of the US population, and as we said, about 22% in Colorado, but as much as 27% of those living below the poverty line. But despite facing those severe housing challenges, Latino households do not access housing resources or programs at the rates relative to their poverty level. So folks just really aren't getting the help that they need at the level that it's needed. And researchers will call this the Latino paradox, that Latinos, and what they say explains this, some researchers, is that Latinos' reliance on social networks and informal support systems have allowed many individuals to avoid homelessness. So despite being a much larger percentage of folks in poverty, Latino and Hispanic folks are not a much larger percentage in terms of homelessness. And this is the reason they say, is that figuring out social networks, supporting each other informally is the reason that folks avoid homelessness. But we think it's important also to talk about additional factors. So as was alluded to in previous slides, there's going to be barriers for people and reasons why they're not able to access services that are available or theoretically available, right? One is ineligibility for federally supported housing programs, including housing choice vouchers such as Section 8, public housing, and permanent supportive housing. A lack of culturally competent service providers and intake specialists. A lot of folks just don't want to go to get services from people who don't treat them well, and that is a very common thing that happens. Lack of Spanish language service providers, forums, and resources, discrimination against people of color and immigrants, fear of being labeled a public charge for those without legal permanent residency, which has a real profound effect on people and their applications for residency. And then also just worth noting that 24% of Latinos are Afro-Latino. So we're seeing people face multi-layered discrimination. They may be facing discrimination because of they're a Black person, and as well as because they're Latino Hispanic, and because of their language, and because of their immigration status. So you might have someone who's stacked in that way. Once again, we will provide these slides, so I know it's a lot of text on one page. So solutions that work. Culturally competent service providers, some of whom we have on this call, so very excited to talk in a few minutes. Spanish language access to services, that's including in-person and written services forms, and services that do not require legal permanent residency, but also have clear communication around this to avoid a chilling effect. So we noticed this in the height of the COVID-19 crisis. Some resources were available to people, even if they didn't have legal permanent residency, but it wasn't always spelled out very well. And so people didn't know if they could apply or not, and it wasn't very clear. And that means that even if people were eligible, they wouldn't necessarily go through the process because it wasn't advertised or explained well. In addition, when we're talking about solutions, we also want to talk about bigger solutions. So federal policy, investment in affordable housing. You'll probably hear this at every education session that you come to. Affordable housing solves our homelessness crisis, according to the data. So more affordable housing and taking down those barriers to access, including multi-room units, because we did see that number higher in families, right? So we want to make sure we have multi-room units and not just single apartment studios. And then, of course, immigration policy reform that creates a meaningful pathway to citizenship, along with fixing a process that has led to lengthy backlogs in applications for residency, asylum, etc. Okay, so now you've heard enough from me. I would love to introduce our panelists today. So I'm just going to give a few sentences on each person, and then we will kick off with questions. As I mentioned, the way this will go is we'll have some planned questions that we'll do for the next 30 minutes or so, and then we'll jump into the Q&A. So add things in the Q&A as we go, and that last 15 minutes will be dedicated to answering questions that you have. So first, I'd love to introduce Luz Galicia, a housing organizer for 9 to 5 Colorado. 9 to 5 is a multiracial grassroots nonprofit organization that combines advocacy, public education, policy work, and leadership development to achieve economic justice. This chapter, the Colorado chapter's movement for economic justice in Colorado, engages directly affected women by addressing issues such as pay equity, work-family issues, housing, unemployment, and protections for temporary and part-time workers. So welcome, Luz. Next, we have Margarita Rodriguez, who is a registered nurse with the Colorado Coalition for the Homeless. Each year, the coalition serves 15,000 Coloradans with healthcare services. In 2022, nearly 37% of all patients the coalition were Hispanic or Latino. Margarita primarily works out of our West End Health Center, which is on West Colfax Avenue in Denver. So welcome, Margarita. And finally, we have Nick Pacheco, who is a program coordinator for workforce development, or La Fuerza, for Servicios de la Raza. Servicios' mission is to build and cultivate a thriving Colorado Latino community in which all members have the opportunities and the support systems to achieve equity, self-sufficiency, and self-determination to lead a healthy quality of life. Services available at Servicios include reentry services, HIV and STI services, basic emergency services, youth leadership, employment and financial coaching, behavioral health, and healthcare access. So welcome, Nick.
Thank you for having me.
Awesome. Okay, well, I'm so excited to get started. I always like to start after a data presentation by saying, now that you've seen our data presentation, Is there anything that surprised you? Is there anything that you think is missing in terms of the state here in Colorado about Latinos and homelessness that you would want to speak to? And that question's for anyone.
I think deportation is another issue why people don't reach out. We have had a few people, just recently, a pregnant woman we're seeing, and her partner was deported, and then she had to make the decision to go back also to her country.
One of the things that I got surprised is that they mentioned kids and youth. And usually when we think about homelessness, we think in adults. And we're forgetting about that every adult has a kid with them. Maybe we don't see them, but they're right there. And after this question, just to honor the topic of today, I'm gonna switch to Spanish.
So I would like to comment on that. Working at Servicios during the migrants when they were coming over here, and it was a big deal real fast. I don't speak Spanish, right? But somehow I got my phone number in the hands of somebody who knows everyone. So I mean, they're calling and looking for resources, and so I had to learn quickly how to navigate using the translator. And you know what? Like, it helped a lot. Kids coming to our door, women and children. That was a tough to see, them in that position. And so I did whatever I could, to put myself in position to be available to help and provide. And I was rounding up big supplies. I don't know what it is about me. I mean, don't start calling me asking for supplies now, because it's starting to run low. But everyone just started donating. So clothes, I donated half my Jordans, my shoes and stuff. So some of them individuals got some nice stuff. But yeah, I'm glad we're talking about this today.
Thanks so much, Nick. And, we're so glad that we have you from Servicios here, because we know, when we were talking about doing the session, first name, top of the list, Servicios, like that's who everyone knows is really doing this work directly in the sector. And so I was wondering if you could tell us a little bit more. I gave like a bunch of lines from the website on what y'all do, but if you could give us, what services you provide, and then maybe what you specifically do at Servicios, because I know it's such a large organization, really to understand what your role is and what you do there.
So I'm going to do my best, which is something I'm good at. I always try to, that's how we are at Servicios. We are continually like learning how to serve better, and it's a learning, it's a process of progress. I'm new. I got to Servicios in 2021 of July 1st. Let me back up a little bit. I have a story myself. I did 21 years in DOC, Colorado. I paid my dues. For the last decade and a half, I educated myself. I sought education and, training to be a mentor. I became, attached to mental health. I was part of the first pilot group in DOC to do mental health first aid training. So I was first MHPA in DOC. Those opportunities got me introduced to Servicios, reintroduced, because I grew up with Servicios. And my pathway was reentry. And when I got out finally, Rudy, he knew all about me. Our reentry coordinator, Jennifer Royballs, she's like family to me. She's the one that's been, putting my name on blast, for a whole year. You're gonna hire my boy. You're gonna hire my boy. And when I finally got there, I stepped to him with my resume and my cover letter. And the first thing Rudy said was, "You didn't write this. Did you do this? Who did this for you? This is good." And I was like, "I did that. That's my work." And so he he gave it some thought. We had a good conversation. He said, "You know what, Nick, I've never done this. No one ever at Servicios has ever been on parole or finished their time and worked for me, as long as he's been there." And so he goes, "I'm going to take a chance on you because of the change you made in your life and the work you did." I've done some amazing things on top of the things I've shared just now. And so I had the skills and the quality and the ability to stand up with all staff at Servicios de la Raza, and so I started my journey in July of 2021. But because of my skill sets and some of my attributes, they thought I would benefit workforce development. or workforce development would benefit from me. And so we had a brand new program to build, and I've been on that mission for about 2 years. But at Servicios, we wear many hats. We have many programs, we have many services, we have many community members to serve. It doesn't stop. There is always work to do. And so being the person that I am, I always get involved. I'm always putting my hand in over here and my hand over there. And you know what, it's benefited me in my career, because I've been able to excel and progress within Servicios. And I'm called upon to do certain things that I love, right? That's the hallmark of my career so far at Servicios is doing what I love. I owe it to my community. All I did was take from it, and now all I do is give back to it. And not knowing Spanish is one of my biggest barriers. I'm like probably one of a few. When I started at Servicios, I was the 34th hire, right? And I'm not going to quote the numbers because, that's not the right place or time, but Rudy, he was always big on our worth, where we're at, and so I always paid attention to that. And today, like 2.5 years, almost, 2.5 years later, man, we're 120 employees. We have grown rapidly. I used to know everyone's name. What I do know is the programs that we provide and the services we provide. I made it my business to know everything, almost everything. I'm sure there's going to be something I forget. Miss Maria Martin, she's our director of STAR. She's on this right now, and she's probably going to say, "You missed this or missed that, maybe." But I'm going to do my best.
Thanks so much, Nick. And, we're all going to miss something, and, we're just going to do our best. And that's why, we have follow-up emails, we have websites. So no stress. Like, I think the great thing is this is such an opportunity for people to just hear from various folks in the sector. And so that's all, we're all just going to tell the parts we know.
I'm workforce development. That's what I do. I'd like to share just a couple more things with you guys. I also sit on the board of directors for Denver Basic Income Project. That's a big deal to me. That's also something I'm very passionate about. I was asked to join a meeting 2 years ago, because I was new, had nothing else to do. They're like, "Here, let's get Nick busy. He doesn't have nothing to do yet because he's learning." Man, in about 3 weeks, they nominated me to be a part of their task group because of my being proactive. And it just grew. I helped build it. I'm a part of my hands invested in it, and I fell in love with providing opportunities for the unhoused. Like just to see their reactions. And I know a lot of them. Coming from the world I come from, DOC, a lot of my friends are homeless right now. They were giants in the penitentiary, men of stature, right? And then they get out, and these streets have broken them down, and with all the different obstacles and barriers and addictions, and it's sad. So to be able to have my hand in that piece, that's an honor of mine, and also I'm on the community corrections board, first time in history, like I'm a board member, and that's me giving back. That's me keeping my word.
Thank you so much. So I'm going to pivot a little. So Luz, you work directly in housing, to talk specifically about housing. You work with community members. And so tell us sort of like what efforts 9 to 5 is making, or maybe just what you're hearing from folks that they really need in terms of housing, and tell us a little bit more about how that works for you day to day.
Thank you. Let me switch. Muchas gracias por la oportunidad.
Thank you very much for the opportunity. I am.
Permítame.
Wait, give me 1 sec.
Muchas gracias por la oportunidad.
Thank you all for the opportunity. I'm Luz Galicia. I work with 9 to 5. But also, I was a resident, actually, that was impacted by society, really, in my community. In Denver Meadows, which is a community with 110 families in it. We were literally displaced from our community. That was a mobile home community. This led me to really start to organize, to really leaderate within my community, be a leader within my community. So we organized ourselves pretty quickly. It was super quick. our neighborhood organized itself, and it was perfect. Now we're organized. Now we have the families organized, but we didn't know what to do. Really, we didn't know where to go. And when 9 to 5 came actually to our space of fight, actually, that's what I would call it, because it was a fight to conserve our land. That's when 9 to 5 showed us to make strategies, showed us to educate ourselves, to really know our rights, which then 5 years ago, since we were displaced, there wasn't that many protections for people who lived in mobile homes. And when 9 to 5 came and showed us these strategies, these work strategies, that's when we actually started to learn our rights, when we started to educate ourselves, when we started to learn who were our legislators, what were our rights as citizens. And that's when I fell in love, really. That's when I fell in love with 9 to 5. And at the same time that I lost my home, I lost my job that I had for 27 years working in hospitality. And that's when I dedicated myself. And this is why I have this huge passion to do what I do. So now that I'm an organizer for communities and that I've actually prepared myself, just like Nick, to give maybe what would I call it? Like another form of support to people, because I already lived through all of this. 9 to 5 has, as you've mentioned, it has the goal of protecting, developing women and their families. But how do we do it? I can't, make a quick summary of what we do it, but we inform, we educate, and we empower. That's what 9 to 5, and what I specifically do within communities is I educate them about their rights. Most of the people the ones that we are talking about, they start actually with all the characteristics that you previously mentioned. They don't have money, they're displaced, maybe for other buildings, and that they have maybe mental health problems, they don't have health insurance. All those things that you mentioned comes together at the end of the day. It's all together. So my work is to help them define what their rights are so they can, further defend themselves. 9 to 5 creates a system which is the base of power within residences that can cater to the needs of these communities and create legislations that can make systematic changes and can really help create legislation in the big run. So something that I previously mentioned was that my mobile home, I mentioned that 5 years ago, there wasn't really any protections for mobile homes. Now, each year, 9 to 5 has helped create protections for people who live and who own mobile homes. And just like that, we're really in that constant fight with rental control, with making sure there's fair evictions. I think last year they kind of killed our movement with evictions, but we have that strength. And we think that the right to having a home is a necessity. It's a basic necessity. Because when we speak about, people who are displaced, we aren't talking about maybe the root of the problem. And the root of the problem is that there isn't accessible homes. There isn't accessible medical services that they can have. There isn't free education that they have access to. And all of this together, paired with the legislations, that's what we here at 9 to 5 are combating with, other coalitions like the Coalition of Colorado, where we can all, unite and make a difference. So me, like an organizer, it's my job to, knock on doors and teach one by one, 2, 3 people at a time what your rights are, so you can actually, so you can fight against a discrimination, an abuse of power. And, I'll conclude saying that in the history of humanity, the only thing that has really fought the power of money is the power of people. And that's what 9 to 5 tries to relay. You have to build that solid base of people, really, at the root.
Awesome. Thank you so much. That was wonderful to learn. And thank you both to you and Nick for sharing your stories along with your work, because I think that's such an important part of what we all do. So Margarita, I wanted to ask you, you work for the Colorado Coalition for the Homeless. We do housing, we do healthcare. In 2018, about 28% of our patients that we served were Hispanic Latino. By 2022, that was nearly 37%. And we also had an increase over that same period in non-English speakers. So tell us sort of, what you're doing at West End to better serve Latinos and or immigrants, and sort of, your work here at the coalition and with healthcare and its relation to homelessness.
So our work, and it's not just West End, it's Stout Street Clinic has the majority of immigrants that are coming in. And, the whole Latino population isn't just they don't all have the same needs, right? Some people have been here for generations, speak English, own a home, have college educations. Some people, especially the newer immigrant, and for a long time we served mostly Mexican immigrants who had sometimes been here for many years. But definitely in more recent times, especially the last couple of years, the last year, we are seeing people from Guatemala, from El Salvador, many people from Venezuela. The original ones that I remember coming before COVID from Venezuela, many of them were professionals. We had a gentleman who was a doctor. We had an engineer, and they had left everything behind and were applying for to be able to stay in this country. And now we're seeing more people who are even poorer coming for so many different reasons, feeling unsafe in their countries, for medical reasons, because they don't have jobs. But the coalition has had to then, be able to figure out how to meet the needs of different immigrants, because depending on where they came from, how long they've been here, some of those needs are different. And so some of the things that we are doing, we do have some front desk staff that speak Spanish, maybe not enough yet. We have some medical assistants who speak Spanish. We have a couple of, I'm Latina, born in Puerto Rico, but we have a couple of nurses who are not Latina who speak Spanish, and a few providers. We have two Spanish, one provider who is from Spain, and one provider who speaks Spanish, whose background is from Mexico, and other providers who are learning to speak Spanish. We've had to learn to translate so many of our forms, right? We had maybe the basic forms, but especially the Patient's Bill of Rights and all that stuff to really translate that into Spanish. As Luz said, when the immigrants have come, they're bringing they're younger. So we have more pregnant women, they're bringing their children. So all of a sudden we went from having a few kids a week or a few kids a month to having many more kids, having different health needs, including a 4-year-old who has a very serious medical condition. So we now have a PEDS day, one PEDS day a week, sometimes more. And we actually have 2 providers that volunteer even from outside to help on our PEDS day. I think they volunteer about once a month. Our big influx is OB also. And so as we serve these new OB clients, we also find that we're booked 2, 3, 4 weeks ahead. And so even our other regular clients are having a hard time getting appointments. So we're talking about maybe having an OB day, just like the PEDS day, and figuring out how that works. But we also know that if we were seeing 20 to 30 OBs a month, and now we're seeing 130, 140, that we're not going to be able to realistically meet those demands through the coalition. And so I know that some of our providers and our directors are trying to seek partnerships with Stride, with Clinica, with even Tepeyac and other places to see how and where we can refer people to meet those needs. That's really a big concern. And so I think our staff is encouraged, and there are some programs to at least learn medical Spanish. And so we're just, I think we're at the beginning of this process, just trying to figure out how to best meet those needs, make people feel welcome, and also refer as appropriate to other community health centers.
Thank you so much, Margarita. I will also mention that we do, as a health facility, have translation that like any medical center. So anyone in any language can come in and use that. But of course, that's like a phone call-in service. So having providers, particularly front desk staff who get the process started, who are bilingual is a much better start to getting folks in the door. So Margarita went into great detail about how Some of our newer immigrants differ from folks in the past and sort of the changes that have been made in approach. Nick and Luz, do you have any similar stories of sort of like pivots that you've made to work with new populations who've arrived in the last couple of years? And Nick, I know you touched on this in the beginning a little bit, you know, with your Jordans and getting more resources for folks who are really coming here. I know buses have been sent up, you know, coming in a different fashion. So maybe I'll start with Nick and then go to Luz for more on that.
So what I would say to that is at Servicios, you know, we're grants, and so there's contracts and there's, you know, rules to certain things. And so me being workforce development, you know, you have to be documented for me to spend funding and support services and stuff like that. But at Servicios, we don't say no to, you know what I mean? Like, we'll find a way. That's how I learned to serve. But I was already like that before that. I mean, I'm a go-getter, and I don't take no for an answer. And so I don't expect our clients to take no for an answer either, you know? And so I started to look around and find places that will be willing to hire, because the thing about, my battery's running low, I gotta plug it in. The thing about the change that you mentioned and the people, and not to take away from in the past, because there's good people that come from Mexico. You know, I mean, I met some good people. They just, you know, they're just looking for work. They want to survive and live and eat, right? Like any human being would want to. But the difference, like, I could tell. I grew up in DOC around Venezuelans and Guatemalans. Like I know the difference. You know, there's different cultures, and it's just kind of it's kind of gratifying to me to be able to help somebody who really wants it, who's gonna do good, who has skills. Like you said, when you're in the beginning of this, there are people showing up in the beginning with mad skills, you know, people who can run a company, you know. And so I find that intriguing. I think that we should change our laws. And you know, I got a message earlier. I don't know what it means, but they passed something today for the Venezuelans. Something got passed today, something good. I think it was good news. So I'm gonna find that out later. Franco, Juan Franco, he was our guy. You know, he's the one that led that whole movement with migrants and all that. And I'm on the same team with him, so I provided support, and I watched, you know, the work he was trying to do to get our city, you know, our government to, you know, use that discretionary word that's in every other law. Discretion. You know, let's help these people. You know, let's do what we can to put them in position to be healthy and to be here with us and sustainable. You know, I'm the last guy to hate on any human being, right? All I want is love in my life. All I want is support, right? That's all I ask for, you know, coming home after 21 years. And you know what? I've been given it. And so it's my duty to give it back. And so, you know, the best way I can, and that's to serve, you know, and to provide the door for somebody. If I don't got it, if I can't do it for you, we're gonna find out today. Before you leave here, we're gonna find out today where you can receive this, you know, whatever you're seeking. And so I mean, that's been my experience, you know, with the migrant situation, you know. And then the quality is everything to me. Quality, you know, I'm not going to give nobody no rags. You know, if I go through the stuff that's being donated for these people, if it's trash or ripped, or I'm throwing it away, right? I'm going to get good stuff. And you know what? And I ask for good stuff too. Everywhere I go, I'm always asking, you know. And that I must have got bit with you know, the bite, you know, when you work at Servicio, where you just start to get in that mode. And I learned that from Juanita Montoya, who ran our BES for years. You know, she ask, you know, closed mouth don't get fed. We need it all. And you know what? That's been beneficial to me, because I go to Franco all the time. Here's more bags. You know, and I'm glad that it's going to people who are appreciative of it, you know.
Thank you. Luz?
Gracias, Nico, por tu labor, Margarita también por su labor.
Thank you, Nick, for all your labor. Thank you, Margarita, too. I'm not really an expert in immigration, I would say. It's not my area of experience, but what I will mention is that in the homes and the communities where I work, there's more people who live in each home. So I will say, people who maybe have lived here, they bring more people in, that implies more expenses, medically more expenses, house-wise more expenses, health-wise, for food, everything, right? And yes, I can say that this is a circle that repeats itself. When a family has lots of people in it and has lots of people living in the same home, sometimes they get an eviction notice because they have too many people in the home, which isn't legal. And these people have now an eviction that isn't legal, and now it's a family, and not only that family, but more people that live within the home who have to leave the house. And now, in order to get an apartment, one of the requisites is, well, I'll actually say that the requisites are ridiculous, that you have to earn 4 times what the apartment rent is, or they ask you to make $8,000, 3 times more when the rent is just like $2,000. Some people ask for immigrant status, which we all know is not correct. So for my priority is showing people that they can learn their rights so that they can defend themselves. And knowing your rights makes you free. It makes you free of abuse. It frees you of power from above. And I'll say that unfortunately there's large possibility that our Latinx community and our Hispanic community can eventually become evicted. So what I want to share with you all is that a few days ago I was walking through the street. I saw a family that had all their things outside. It was a mom and a daughter that was 5, 6 years old. And the girl was covered with a little blanket, right? And I kept seeing people walking by and would just look at them like, what's going on here? That ugly, dirty blanket that we see, and we're like, we don't know really what's the history behind that blanket. If it came from, maybe the grandparent that passed away, or the grandma, or one ancestor from behind. That's why I have so much passion within my job. That's why I enjoy so much working with 9 to 5, because we're always working with how to make legislation, how to make coalitions, how to make these preventative measures that really go against that and are preventative, and, prevent that people keep paying for high cost rent rates and, eventually reach, to that point where you're someone without a home. So we all need each other to work together, to work in harmony to really reach all of our goals.
Thank you so much, Luz. And I will mention that my colleagues have put in the chat a link to a fact sheet on new renter protection based on some legislative changes from the last session. So we do have that there. We don't yet have it in Spanish, but it will be on our website in the near future. And when you get your follow-up email, just feel free to write back to us, and we can always send you it when we have it if we don't have it yet. Luz, I'm going to stick with you for a moment. We know that displacement and gentrification is huge in Denver, huge in Colorado, particularly with historically Latino communities. And so, tell us about some of the things that 9 to 5 is maybe doing around that, or just what you experience in working with folks, and, obviously your personal experience around that. But, we know that housing is expensive in Denver, and we know that the people who are being displaced are often Latino folks. So tell us a little bit about that and sort of what 9 to 5 does in that sector.
Claro que sí.
Yes, of course. Unfortunately, I'll repeat again that we're talking about people in power, people with money, right? And these displacements in these areas are due and are given to people who are most vulnerable. I would say that's the denominator of this. In my community in Denver, in Middlesbrough, right next to the hospital, actually, the university hospital there. And we actually plan to do, I think they were trying to do some industrial construction there, but they look around and they're like, who are the most vulnerable people here that we can, take out of here without giving them any type of economic support, right? And it's obviously the older people, people who are undocumented, Hispanic minorities, Afro Americans. Displacement, unfortunately exists. There isn't legislation that prohibits, making the city pretty. That's always the excuse that they have. And unfortunately, our communities are always pushed to sides who are more hidden, where there isn't water services, where the quality of life is different because, they have maybe some of the factories, some industries scattered here and there. So, displacement that's being done, with that whole excuse of making the city pretty, unfortunately, always affects the most vulnerable population.
Thank you so much. I'm going to cheat a little bit and go into the Q&A early, but it's sort of something that we were going to ask, and the way that McKinley Thompson here in our Q&A asked it, I think is helpful. And it says, what can service providers do to be more welcoming to the Latina, Hispanic, homeless community? How can we build more trust? So tell us about something that maybe your organization does that makes you more culturally competent, more accessible, more welcoming, that people do want to come through your doors, or what you would recommend for other organizations in order to sort of meet this community where they're at. And I'll start with Nick on this one.
So I'm going to say, we meet you where you're at. We go to the community. We put on big events. We connect. We do in-reach. We visit institutions. We visit schools. We deal with the kids and, so show support with the youth. So that's what I would say to that as far as connecting with the community. We are the community. We embody community, lived experience. We have a lot of lived experience at Servicios. We have, if they haven't had lived experience, because there's a lot of younger individuals that work there fresh out of college, but you know what? They're connected to lived experience. They've had a family member, a close family member that has suffered behind different barriers and stuff. And so they live through it that way. But I like to always give them a little credit and say, look, you're living the experience now through us and through the community. You're learning, you're on the front lines, and understanding. I think teaching your agency, how to serve, how to understand certain situations, training. Oh man, I'm in a training every week. It's like our remote day is another training, but you know what? I'm the guy who's always talking in the trainings, and I love it because that's what I did my whole life, was trainings and classes and programs, and it brings people together. That's the most important thing. It brings the team, the agency together to work together in a training workshop or something. I like them. That's something that we do a lot often. Understanding inclusiveness and what that means. When I started at Servicios, those were, what? Inclusive, what does that mean? There was verbiage that I didn't understand or know yet. I'll just be transparent. I didn't know it yet. I didn't know what it meant. But today I do. Equity, like all these different things that community represents, CBOs. Yeah. Embodying that with your staff, newer staff, make sure that they represent, what your mission is.
Awesome. Thank you. Margarita, jump to you. Sorry, you're muted. So thank you.
Thank you. Obviously, having multilingual staff is important to make people feel welcome. And that's the challenge. As Nick, it's not easy to all of a sudden learn another language, but when possible, materials and other things. And I think also maybe cultural competency for staff. I know that that is part of our requirements, but continuing to do that, because the needs, and we can't assume that someone who is homeless versus someone who is homeless and has lived here a long time versus someone who is homeless and is a new immigrant, and depending what country, that they all have the same needs. I know that we need to, we have legal services once a month for 2 hours. That's really just not enough. I know also that I think our caseworkers, they're already learning how to serve the needs of many of our clients who are homeless and trying to get their documents. But having to get documents, for example, from another country, or doing understanding some of the work visas and all that, is a totally different area. So maybe it also needs more training, so that we have case management at least who can help support and navigate our clients, so that as Nick and Servicios do, we can provide or know of the resources that exist in the community. And I don't know that we're that familiar with all of the different resources that our clients may have options to, or we need to challenge that we have some of those, including, for example, more legal resources.
And Luz?
Sí, muchas gracias. Una pregunta muy importante.
Yes, thank you. It's a very important question. So in 9 to 5, you know, knowing our members that join 9 to 5 and the people who are affected by 9 to 5, most of them are Hispanic, right? So 9 to 5 counts with bilingual staff. Absolutely everything that we do, including legislation that we pass out, is bilingual. English and Spanish is always, you know, a part of it. And, you know, redacting that direct contact with, you know, future members and with residents in different communities, right? We're very proud to say that the last legislations for mobile homes and rent control and evictions with unjust cause, those people who, you know, went to go give their testimonies to the Capitol mostly were Hispanic, and they did it in Spanish. And that shows that they can start to have, you know, that trust in the work that we're doing. And I say we, including you all, right? Including the work that you're all doing, because the work that we're all doing, being leaders by example, leading with honesty, and of course, preparing ourselves every single day to show and project that trust towards them and tell them, hey, we're working as a team. Here we are to serve you.
Thank you. I'll address another question in the Q&A from Gil Carroll. So Gil wanted to know about statistics, what the population, where we got our statistics. So just so you know, when you get the slideshow in the future, if you go to the notes section, you can see our references. But I will mention, I believe that one came from the Colorado Health Foundation Pulse Report. Most of this data that we gave in the beginning was either from there, the National Low Income Housing Coalition, a report from endhomelessness.org, or the 2023 Colorado Latino Policy Agenda Survey. So those are all things I'd look at, but you can always email us and we can get you more, Gil. I also, one of the questions we have is about regarding those who are exiting the carceral system. Wanted to know about, you know, folks who have disabilities and then obstacles to being housed. So we did have a session on people experiencing homelessness and disabilities a few months back. You can find on our YouTube page. But we know that, you know, essentially what we know is that there are certain characteristics that make people more likely to experience homelessness. Having a disability is certainly one of them. And so once again, if you have someone who has that compounded thing of having a disability, experiencing being in the carceral state, being reentry, all of those are just compound factors, especially with the barriers to housing that we have for ADA accessibility for people, you know, coming out of prison. So, you know, I don't have a great answer. I don't know that anyone on this call necessarily has a great answer on the percentages of Latinx folks with disabilities, because I don't know that we have a report I can think of that cross-references that, but I wanted to be sure to acknowledge it and, you know, let you know that we're working on covering these types of topics in different ed series. And you can always email us and tell us if you have something you'd like to cover, and you know, we're planning out next year, so let us know. I did want to ask folks, Luz, you were talking about advocacy that 9 to 5 does. And so I wanted to give an opportunity, you know, Nick, you were talking about how people make donations. I want to give an opportunity for everyone to talk about what you can do. If you're on this call and you're like, I want to help, I want to get in it, I have different skills or different ways that I can assist. What can people do who are on this call to help with your organizations? And Margarita, I can help you to, you know, we can both give answers for CCH. So maybe we'll go last and I'll start with Nick.
Well, like you said, you know, get involved, you know, donating, it's just having courage to go knock on a door. You know, I'm a big networker. I'm always wondering who does what do they do over there? You know, like you mentioned, disabilities, right? Bayard, you know, so like that's how my mind works. I'm always writing, taking notes and who does what. So, you know, figure out where, like you said, where you're best skilled at. And, you know, come provide support, you know, if this is a field that you want to get into, you know, I would get educated on communication, you know, motivational interviewing skills and just learning how to speak and, you know, and having empathy and learning when, you know, to say something. I'm learning as I go. I'm talking about all the things I did wrong, you know. In the beginning, you know, I was very passionate. Oh, we could do this and we could do that. And then, you know, my director's telling, hey, hold on, we're not there yet. We can't do that yet. You know, we're waiting for the contract. So I just know, I guess, know what your capabilities are, because you do not want to let someone down. You do not want to get their hopes up and then, you know, that's a bad, I had experienced that, you know, telling somebody, hey man, I'll jump the gun, I'm sorry, but we're going to try, you know, we just be patient. But you know, at Servicios, we're always looking for volunteers, interns. Like if you're going to school right now, do you know that we have directors right now, or actually a vice president, maybe if she's an intern? We are the top of our you know, of Servicios. Some of them were interns and they were just so skilled and so gifted that they climbed their way up and they became employees, staff, and you know, that's the opportunities you get at Servicios. Just show up. We'll see it. You know what I mean? You will see it. It will feel it. And you know, they can go take it from there. You know, and sometimes at Servicios, it's not a landing spot completely. It's a pit stop, right? Some come get the education, they get that spirit, they learn, they soak it up, and they move on to the places that you know they're destined to be, right? And so that's one way of looking at this life too, is that, you know, this field is loyalty. You know, don't get caught up loyal to the entity. Get loyal to the community, not the entity, the community, right? Because if you're always serving the community, man, you're winning. That's what you're supposed to do, right? Serve. So I guess you know, that's where I'll stand on that.
Thanks so much. Luz, how about you?
Hi, Nick. You just said something very
Nick,
nice.
you just said something really nice, being loyal to the community, right? And 9 to 5 really wants to
That is one of the campaigns that we have. Participating, getting involved. I know that everyone here has a friend, a neighbor, a compadre. Voy a cambiar a español. Que tenemos un compadre.
that we have maybe a friend, someone in the community who's passing through a problem really of addiction. You know, 9 to 5 wants to hear those stories and take them with us, because we're coming strong for next year to hopefully pass a legislation for just cause, evictions for just cause. And we really need those stories that align with us, you know, to take them to the Capitol, to show them to the Capitol, so we can actually hear those representatives, you know, hear their feelings, so they can hear the truthful stories of the people who are really living in our communities, who are suffering in our communities, because there isn't those legislations that currently protect them. So I would say, I think I can put my information right there. I can write it down. If any of you, as we say in my community, are bold and want to do it, please, please, it's super important. you know, to raise our voices as a community. And at 9 to 5, what we're doing is doing that thing exactly. We're creating really a strong base of people so we can actually raise our voice together, and so we're heard. So I would say that's something that you could do with 9 to 5. We're coming in strong, and you know, we have just cause eviction coming up next year and other legislations that are very important. So if you want to call me, put me in the loop, and we can make this happen.
Thank you so much. Margarita?
Well, we also have some volunteer opportunities you can contact. I think getting involved in any legislative action that has to do with immigrants, with housing, with homelessness issues in Denver would be great. And if you speak Spanish and want to come and work for the coalition, see if there's a job where you fit in, especially, again, areas of case management and legal services that we probably need more support on. So those are some
Thanks,
thoughts.
Margarita. Yeah, and I'll just add to that, just to flesh that out a little bit. Yeah, so we have a volunteer manager, and so he does everything from somebody who wants to volunteer who's a nurse or a doctor, an ophthalmologist. We have folks like that. We have service projects. If your organization wants to do a service project, we have guidelines on how to make little packets to hand to your neighbors. Just if, you know, some people don't want to go to an organization to work, what our clients tell us is the most useful to just have in your car when you see someone and hand out. We have our advocacy committee, advocacy network, and so you can join and then basically, you know, do that thing where you sign the petitions. But also we do love getting the stories, as Luz said. That's very important to what impacts legislation and legislators, is understanding the real stories of what happened to you and how your rent went up and how you were displaced. So any of the organizations that are working in this sector, you know, it doesn't have to be us, go to anyone. If you are willing to share your stories, if you're willing to be in our legislative day of action, check us out, and you can do those things. And then, yeah, as Margarita said, we are hiring generally, and we are always looking for bilingual staff. And I'm pretty sure we have a like an additional bonus that you get if you're bilingual to work at the coalition, but I'm not 100% on that, but I'm like 99%. So we've hit the end of our time. As I said, if you have follow-ups, please feel free to email. But Gabriella, if you could share the slides, we can tell you a little bit about next month. Just really, well, first I want to thank everyone who was here today. Oh, go Nick.
I just want to say a quick plug.
Yeah.
Tomorrow at 11 o'clock, we're going to be marching at the Capitol. You talk about standing up to government and campaigning. We were going to be down there and rallying for basic income. Servicios is standing up, all staff on deck. Bayard, you know, we're all going down there. So come join us, show support. We need to keep the Denver basic income program going.
Awesome. Thanks, Nick. And Aubrey, if you happen to have a link to anything with that you can put in the chat. Yeah, it's 11 o'clock. But yeah, Denver Basic Income Project, which is essentially a pilot program that's providing money directly to people and seeing how that affects their lives. It's going well, and the preliminary data is great, and we want to show support for that. Our organization's part of it, Servicios is part of it. So come support that in person tomorrow, and you know, you can meet these famous panelists in person maybe if you go. But first, I just want to thank everyone. Thank you to our panelists. You all were amazing. It was such a robust and wonderful conversation. Thank you to the many people who joined. We know that this isn't how everyone chooses to spend their Thursday afternoon, evening. There's a lot going on, and it's a beautiful day. And anyone who chose to spend time on this topic, just thank you so much for being with us. And then I just want to do a little bit of a plug for next month. We're talking about people, and if Gabrielle, if you can share, if you have the slide, we're talking about people who fill the gap. So there's service providers like all of us in the work we do. And then there's people who are de facto service providers who maybe didn't intend to work in homelessness, didn't intend to work directly in this sector, and they do because this is where community members need us. So we're talking about libraries, we're talking about schools, we're talking about transportation, and we talked a lot about children today. And so we'll be talking about that next month and sort of like what we do within our school systems, libraries, transportation, in order to those people who work outside the sector, but in the sector as well. So please sign up and join us next month. The registration link for that should be in your follow-up email. And that's it. Thank you so much for your time. We're wrapping up for today. We hope to see you next month. And really, please do fill out the survey. Please do tell us what you want to cover. We read through all of it, and we're planning 2024. So we want to know what you want to hear more of. Thank you all so much. We'll see you next time.